MDDM clinical pharmacologist, and today I am going to discuss on fever management. You all know that fever means temperature more than 100 degree Fahrenheit. If the body temperature is more than 100 degree Fahrenheit, then you have to take paracetamol. If it is less than 100 degree Fahrenheit, you have to use cold sponging. And if a patient is suffering from fever, headache, and associated features, then first of all, you might thought that it will be due to common cold fever, viral fever. So he can take paracetamol. But if within 2 days of paracetamol, proper dose taken by the patient, if the fever do not recover, then he or she should have undergone the blood tests for malaria, dengue, etc. Like he or she has to do blood tests like complete blood count and MPDA, malaria parasite dual antigen, and thick smear, thin smear, and also dengue NH1 antigen, dengue IgM antibody, viral test for typhoid after 5 days of fever. Then also we can do typhoid if viral is negative and patient is suffering from high grade fever. Then urine routine microscopy, urine REME, and if urine post cell is more than 6 to 10, then the patient can do urine culture to find out the culprit bacteria, and according to the culture the patient can take antibiotics like ofloxacin, those antibiotics to which it is sensitive. And if the patient is suffering from, we can test suffering from cough with fever, productive cough, then if the cough is remain persistent more than 14 days, then the patient can do sputum AFB, acid fast bacilli, and also he can do the sputum test and chest X-ray, PAV, and if tuberculosis was found, then he will be treated according to National Tuberculosis Control Program, National Tuberculosis Elimination Program, NTEP guideline. According to tuberculosis guideline, patient will be managed. If the patient is found to be positive for HIV antigen, then the patient will be managed with HIV regimens, antiretroviral therapy, and if the patient is positive for found to be positive for hepatitis C antigen, then hepatitis C treatment like regimen like sofosbuvir, valpartaspir, etc. can be taken according to the guideline. And if the patient is found to be positive with hepatitis B antigen, or then hepatitis B treatment will be given like entecavir and tenofovir, and hepatitis B regimens can be given after hospital admission. And if the patient is suffering from cancer is the cause of leukemia is the cause of fever, then leukemia guideline should be followed for the management of the patient. If the patient is the drugs like methotrexate and other anti-cancer drugs can be used in case of leukemia according to leukemia regimen, according to guideline, he or she will be treated. And if the patient found to be of acute rheumatic fever, then according to guideline acute rheumatic fever to be managed. And if the patient is suffering from chicken pox, then antiviral drugs like acyclovir to be given according to the guideline. And if other disease like scrub typhus occurs, then doxycycline azithromycin should be given according to the guideline for the improvement of the patient. And if he is suffering from chikungunya, he is suffering from dengue, then dengue management, dengue NH1 and IgM is positive, then dengue management to be given, but there is no drug for dengue. That's why paracetamol will be taken by the patient, and also fluids rehydration therapy should be given. If the patient is stable, then can take ORS. If the patient unstable, then IV fluid can be given. Hospitalized, the patient will be hospitalized and IV fluid to be given. And also the platelet should be monitored in case of dengue, as chance of platelet reduction in dengue, and it can lead to hemorrhage. And that's why if platelet count is less than 50,000, then he or she should be admitted in the hospital, and fresh frozen plasma and other dengue guideline, other management following dengue guidelines should be used. And if there is other diseases, if there is malaria, then malaria is Plasmodium vivax, then Plasmodium vivax treatment will be given. If Plasmodium falciparum, then falciparum drugs will be given. And the patient caregiver and family should support the patient so that the patient immunity will not be hampered and patient health will remain in better position, and patient will improve quickly. And then if there is other diseases due to fungal infection or due to chronic diseases, then there should be diagnosis of the disease, and according to the diagnosis we have to manage the patients. If he is severe, then hospitalization needed. If stable, then he can be treated with the drugs at home. And the most important in fever is that we have to diagnose. The diagnosis is the most important, and according to the diagnosis we have to treat the patient. So fever is, sometimes there will be no diagnosis, then the fever will be given as the name pyrexia of unknown origin, that is PUO, or fever of unknown origin, FUO. So in that case the patients can be admitted in the hospital, and routine investigations and all types of investigation to be done and managed properly so that the patient can be improved. And we think that fever is very easily managed. But if you do not show any physician, if you do not diagnose, then it can lead to complications like hepatomegaly, splenomegaly, and also kidney damage, liver damage, and also the neurological problems can be seen. Cerebrum can be affected by malaria, cerebral malaria can occur, and also dengue can affect the joints, hemorrhage can occur, and other urinary tract infection can cause kidney stone, renal stone, or bladder stone, or kidney damage. And if you don't manage all these things, then the complication will be more. And if the patient is suffering from diabetes or some immuno other diseases, then he is at risk of delayed recovery or severe manifestations of fever. As in COVID-19, there is seriousness uh, complications in case of diabetes and heart failure and other dyslipidemia and other uh, patients, as their immunity is low. That's why COVID-19 virus affected them much more than normal persons. So they have to hospitalize prolonged period in the hospital, and very difficult to manage all these patients. So fever can be also due to respiratory syncytial virus and other monkeypox, etc. Lots of diseases, Japanese encephalitis, chikungunya, and so many causes of fever. So we have to diagnose first the disease, and according to that, we have to manage the patient properly, and the patient can lead a good life and will be improved quickly if the diagnosis is if there is early diagnosis and proper management according to the guidelines of different diseases. So so uh, that's all, and for this session, and I'll meet you again in different sessions about different topics. And if you have any question, please ask me, so that I will I am trying my best to answer your questions. Oh, there are no one now. Leave the one person is now joined. Please ask me any question if you have. If you don't ask any question, then please subscribe my channel, and there are lots of videos about disease management, drugs used in different diseases. So you follow my videos, watch my videos, and learn lots of things from my videos, and help others also. Hi, Only Pond TV. Hi, Only Pond TV. How are you? Please ask some questions about fever management. No English, Hindi. Okay, but I have done twice today on this topic in Hindi and Odia. हिंदी में भी बोला था, उड़िया में बोला था, मगर वो ठीक से उसका अपलोड नहीं हो पाया। हिंदी में बोलना चाहो, ठीक है, हिंदी में बुखार का मैनेजमेंट में ऊपर कुछ बोलना चाहते हो तो पूछ सकते हो। हेलो, बुखार के बारे में अगर कुछ पूछ सकते हैं तो पूछ सकते हो। ये ठीक है, आप तो जानते नहीं हैं इंग्लिश, तो मैं हिंदी में ही बात कर रहा हूँ। बुखार में एक्चुअली क्या होता है, ट्रीटमेंट के लिए पैरासीटामोल यूज होता है और हमको उसका कारण निर्धारण करना पड़ता है। वो कारण के हिसाब से किसके वजह से हुआ, मलेरिया के वजह से या डेंगू के वजह से, उसके हिसाब से हम लोग मैनेज करते हैं। ओके, ठीक है। आप अगर क्वेश्चन नहीं पूछेंगे तो आज के लिए इतना ही। धन्यवाद। थैंक यू वेरी मच। जय जगन्नाथ।